Mary-Louise McLaws joins me now from Sydney. She's an advisor to the World Health Organization. Thanks so much for your time for us. 19 million overall. And in the meantime, several countries are promising vaccines soon. The big question is, how far away are we from having actually one that works?
Look, I don't think we're going to get one anytime soon. There's a solidarity trial that WHO has brought together many countries. There are over 160 candidates vaccines that have been getting ready for trial. About 26 of those are in the clinical phase. But don't forget, it can take a very long time to identify the side effects, the dosing. And we don't really want any virologist or any pharmaceutical company to be pressured into getting this to the public by cutting any safety corners. And so the best that we can do as a community is to put in place all of the public health interventions that we know work: social distancing, physical distancing, wearing a mask, getting tested, isolation, hand hygiene, good environmental cleaning. And that way we can get the numbers down while we allow the virologists plenty of time to get the right answer and the safe answer to production, and then roll it out. And even then, when they get the production, who will they roll it out to first? And that's the big question.
So exactly, if the country finds a vaccine, will it share with other countries? We heard from Scott Morrison just a while ago saying they should share it with everyone as soon as they reach some results with this.
They should. I mean, ethically and from a humanitarian perspective, they should, of course. Of course, there'll be some sort of nationalism going on by countries that feel as if they've been providing most of the funding for these vaccine trials. However, we're all in this together. WHO would like 500 million children to be vaccinated. And of course, every country wants their first health line, their nurses and doctors, allied health and environmental cleaners, of course, to get this vaccine. And then who do we then give it to next? And perhaps countries need to think about the ethics of that, and also their epidemiology, that pattern. So at the moment, in some countries, it's being driven by the 20 to 39-year-olds who have a lot of connection in the community, and they could be appearing to be pushing this virus into, of course, the older groups as well. Maybe we would be best to think about vaccinating those and then vaccinating the children as they come into a more adult immune response to protect them from catching COVID as well.
Mary-Louise, just in the last hour, India announced they hit 2 million. The country confirmed just the last million cases in just 20 days. That's faster than the US or Brazil, which have higher numbers. Now, how worrying is this?
Oh, look, it's very worrying. There could be many reasons why this has occurred. They could have had an enormous delay in pathology because, can you imagine, tens of thousands of people getting tested every day? It's hard for pathology to keep up with it, even by doing testing by batches, putting everybody's test into a batch, and then if that tests positive, then go back and test within that batch to see who became positive. Nevertheless, what it's saying is that any of the public health interventions that they're using may not be strong enough yet, and they may need to think about adding extra restrictions. Of course, they have to be done humanely. In India, there are a lot of homeless and, of course, those that need care and support from the general community. So they need to think about how best to do this. And one approach may be a rolling on of restrictions and then a lifting and then a rolling on. That's been considered. We really don't know how effective that is and whether or not all we get is peaks and troughs of numbers. So certainly mask use, universal mask use, hand hygiene has to be the way to go. But it's very, very concerning.
Mary-Louise McLaws, thanks so much for that. I appreciate your insights. She's an advisor to the World Health Organization.